for the Consumers Health Forum as their Business Development and Engagement Advisor and leading the current work on collaborative pairs. So thanks everyone for attending today, and I just really hope that this session helps to provide you with some more information or also clarify some issues for you and helps you to, make a decision about whether you'll continue with the process of applying for this exciting opportunity. We're very excited here at CHF about this program. So what I wanted to do today is there's probably 3 components to this presentation, and I'll stop in between each and take questions, but you're most welcome to start writing questions as you think about them, and then I can respond to them at the appropriate point. Just before we get started, I'll also let you know that this is being recorded and this will come out through the CHF YouTube channel either later today or tomorrow. So in case you're aware of any colleagues or if one of your partners isn't able to attend the session, they'll be able to sort of hear it. So what I wanted to do is, I'm hoping that most of you have had the opportunity to actually download the information sheets, look at the facilitator training EOI. So I didn't necessarily want to rehash all of that, but really sort of highlight or emphasise what's really important about this program and what we're really looking for in terms of the first cohort of facilitators that we're in the process of recruiting. So I'll just begin with really talking about not the facilitator training program, but the collaborative pairs program. And as we've stated in all of the flyers we've put out so far, this is a collaborative program between the Consumer Health Forum of Australia and the King's Fund. So this is a program of the King's Fund, which is a major charity, a very prestigious organisation in the UK, which many of you may well be familiar with. They've done a whole lot of work in the area of health and primary health care. So basically, we'll be looking at the program in Australia, the key components. Now, the major aspect of this program is that participants undertake the program in pairs. So this is really focusing on a clinician. Now, it could be someone who's currently working as a clinician. It could be a health service provider in a clinical role. It could be someone who's had clinical experience, who's a clinical lead in a local health district or a primary health network, and a consumer. And the consumer, again, could have a variety of roles. They could be a consumer advocate, they could be a chair of a consumer advisory committee, they could be a community representative and spent a lot of time advocating for community issues in health. I mean, I think the main aspect for pairs coming into the program is that they need to come in working on a joint project. So when they actually participate in the program, when it's actually being delivered, we're looking for bringing together a health service provider and a consumer who can work together on a joint project. And those joint projects could be a whole range of things, from sort of co-designing services to developing communication to developing an assessment tool. So a whole range of projects that could span across a community setting, a clinical setting, or an inpatient facility. It's a 5-day program and it's run over a 6-month period. So there's a session every 5 to 6 weeks. And the reason it's structured that way is so that it gives the pairs the opportunity to work on the project and to see how they're going with that, in particular the relationship issues. Because one of the key aspects of this program is it's about building the capacity of consumers and health professionals to work together in a way that brings about a true and equal partnership. So as we all know, whether we're the health professional or whether we're the consumer, that there will always be points of difference, and there'll be points of difference around a range of things, around perspective, around expertise, and around, and of course the power relationship dynamic. So this program is really about trying to develop the knowledge, skills and experience in developing those skills that are needed to bring together two people that are going to have, who are going to come from quite differing perspectives. So it's about focusing on holding the critical conversations, the influencing and negotiating skills, and being able to arrive at a respectful position where both understand and respect the perspective that the other's coming from in a way that they can shape health services or the system working. So that's really the guts of the program, without going into too much detail around what participants will expect to get from it. So participants who will engage in this program when it's eventually rolled out will expect to gain a lot more skills in developing the relationship dynamic, specific methodologies around doing that, and the opportunity to work together on a project in a new and different way. So it's going to require people to be open to reflecting on their own experience, open to change, to being changed themselves in their attitudes and views, as well as to change and shape the system. So participants in the program will receive input on action learning, peer consulting as models for developing effective partnerships, appreciative inquiry, open space and World Cafe methodologies are also introduced, and their advantages and disadvantages will be explored. Some of you may well be familiar with some of these methodologies, some of you may not be. The program also uses a knowledge capture process. So really what that means is that it's a bit like action learning, that participants will have the opportunity to reflect on their own learning as they go through the program, and then use that reflective learning to develop goals and to move forward. So they're continually reflecting on their practice and then moving forward on the basis of that reflective practice. Some of you might be asking, well, why are we bringing this program from the UK to Australia? Don't we already do this in Australia? And to some extent, some of you may think, yes, you are, and that may well be the case. But I think much of the training and capacity building in Australia is done still with consumers and health professionals in their silos. So we do a lot of work in consumer engagement and consumer participation with health services. There's programs to train and develop consumers as advocates and as leaders. But probably it's very limited in terms of having them in the same room together, working on sort of collaborative projects together. So that would be probably the main point of difference and the main reason why we're bringing this program to Australia, so that we can really begin to develop that partnership approach into working with each other in new and different ways that is more regarded as equal rather than an unequal relationship. So that's the actual program in a bit of a nutshell. So I might just stop there before we go in and talk about the national demonstration trial and the facilitator training, just to see if there's any questions about the program itself. Okay, so one of the questions coming up, and we've had a few questions like this, is around eligibility. This person is based in South Australia and wondering whether they're eligible to apply. The answer is yes. At this stage, we have 4 primary health networks, 2 in New South Wales and 2 in Victoria, that are actually involved in the national demonstration trial. So if you look at the selection criteria, you'll see that under desirable, it says as a consumer having advocated or been doing work as a consumer advocate in one of those areas or as a clinician. However, in saying that, we're also looking for the right people. So we don't necessarily want to say to people in other jurisdictions that they're not eligible to apply, but if it comes down to people across the board all having the same skills, knowledge and experience, preference probably will be given to those jurisdictions that are going to make the actual logistics of delivering it more accessible. But from an eligibility point of view, absolutely yes. Okay, the next question is regarding the clinical lead. Do they have to be an allied health practitioner? Can they be a community engagement officer, case manager, someone who has social work experience but not have allied health? If you look at Appendix A, it gives you some ideas about eligibility. The main thing about the clinical lead, it's not what the actual title is of the person is less than important. The more important thing is that they've had clinical experience, and by clinical experience is they've provided a clinical service. Now that could have been as a social worker, it might have been as a case manager. The absolute imperative for the clinical lead is that they've had experience providing clinical services. Do you need a defined project for the application? No. I think what's important to stress here is there's a difference between being a participant in the program and being a facilitator, which we're now calling for expressions of interest for. The facilitators will be the ones leading and delivering the program in the first instance. Now, when they undertake the program as trainees, they're going to be doing it in a truncated form because the program is going to be run in the UK, it's going to be run over 5 consecutive days rather than once every 6 weeks. So we're not necessarily expecting the pairs coming into that to have a defined project, but we would hope that they've already had some experience working on a committee together or on a project. But we certainly want that. We certainly need the pairs who will participate in the program once it starts to be delivered to have a defined project. But you don't need it for the application. The costs are being covered regarding training in the UK. At this stage, CHF will be supporting those who are successful with flights, accommodation and meals and a manual for the duration of the training program, but they won't be actually reimbursed for their actual salary or their income during that time. And the reason for that is that we believe that we're providing people with a real development opportunity, which could have quite significant repercussions for them back in Australia. In terms of when they deliver the training, they will be paid for delivery of the training and travel costs to and from where they're delivering the training, and for planning and supervision time that they will need to undertake as part of being a facilitator. Preference will be given to people who, it'll be a merit-based process, so it's going to be based on the strength of your application. So again, if there's any preference, it's going to be for people who are working or living in the areas in which we're undertaking the demonstration trial. The next question is an interesting one. Is it fair to say that if you are not a clinician, you are a health service consumer? I guess it could be fair to say that we're all sort of health consumers, but probably for the purpose of this exercise, we're really looking for consumers to be those who've had a significant lived experience of engaging with the health system and who probably spent some time being advocates of the consumer perspective. If that's at all helpful in terms of delineating maybe where you fit on either spectrum. After the facilitators have completed the training, who will the training be delivered to? I might just leave the questions here and go on, and I'll come back to this one because that may be answered if I can just go back to the slides, because I'll talk a bit about the national demonstration trial now, I think, and that might clarify some of these issues. So we've talked a bit about the program. What's happening is that the actual delivery of the program is a collaboration between the Consumers Health Forum of Australia and the King's Fund in the UK, who are the architects and the developers of the program. However, the partners here in Australia, those who are providing the foundation and funding support to this trial, are 4 primary health networks, and they are the ones listed there: West, Western New South Wales, Northwestern Melbourne and Southeastern Melbourne. And we've also been very fortunate to secure funding from the Australian Commission of Quality and Safety in Healthcare for an external evaluation. Now, the King's Fund have only been running this program for a short period, and they haven't even done an external evaluation on it as yet. So as part of this trial in Australia, that'll be a world first. So we're currently in the process of recruiting. We'll be putting out a tender shortly for recruiting of an evaluator. So it is a 2-year project and it has already commenced. The last few months have been involved in establishing the steering group, which consists of the 4 founding PHNs plus the Commission, plus CHF and the King's Fund. So we've established what we're now calling Collaborative Pairs Australia. We're currently in the process of recruiting the first cohort of facilitators, to which you're all, hearing about at the moment and potentially interested in, and an external evaluator. We'll undertake the facilitator training, and in this first period of time till June next year, we'll launch Collaborative Pairs Australia. In the next year, which will be the next financial year, July 2018, which is the question that was asked before, what happens after the facilitator training, the program will be developed by those facilitators. So we're looking for 4 pairs of facilitators, and they'll each deliver 2 programs, initially in the 4 primary health networks that are the founding members of Collaborative Pairs Australia. Now, in saying that, it's going to be up to those primary health networks how they want to deliver their programs. So, for example, they might want their programs to be solely for people from their primary health network area or local health district as well, or they might want to invite registrations from neighbouring PHNs and LHDs. So in terms of how that will pan out, that's still to be decided. We're going to be entering into a planning phase early next year with the primary health networks on exactly what that model will look like for that second year. But from a facilitator point of view, the commitment we're asking from the facilitators is that they have to be willing to run 2 programs in that year. And so those programs will be 1 session every 5 to 6 weeks. So hopefully I've answered the question that the previous person asked. I'll stop there again and take any questions before I move on to talk about the facilitator training more specifically. So if there's any questions about the actual trial. Okay, the question is to get an understanding of what clinical service in this context is it fair to say that clinical services is any service that is to better the health outcomes of consumers? Look, I think we can be broad or narrow about this, but I think in broad terms, I think when we talk about clinical services, we're generally talking about medical, allied health, nursing, pharmacy, psychology. So it's a whole range of services, and I include sort of pharmacy in this. We're not just, it's broad primary healthcare services that we're talking about here, where there's engagement with a consumer, where they're going to need support and help for a clinical diagnosis. So that treatment or support or assistance can take a variety of forms. It can be medication, it could be psychosocial support, it could be pharmaceutical, it could be a range of things. One session is a day. It's a day. We're not looking, they're not per PHNs. The question is, are you looking for one pair per PHN? The facilitators will be contracted to CHF for undertaking this facilitator role. So as much as the primary health networks are funding and supporting the national demonstration trial, the facilitators are contracted to CHF. So basically they will run two programs. It may be within the same PHN or it could be in two different ones. That will need to be worked out. The liaison about where they run them will be in collaboration with CHF and the PHNs. Okay, so if we move on to the next, to the facilitator training. So I've talked about the program and I've talked about the national demonstration trial. So the key to kickstarting the demonstration is that we do need facilitators that are going to run these first set of programs in the 4 PHNs. Now, before I move on and talk about that, we are still encouraging other primary health networks to come on board. So at the moment, these are the 4, but it doesn't necessarily preclude some other primary health networks in other jurisdictions or in the same jurisdictions to come on board over time. So in terms of the facilitator training, we are now wanting 4 pairs, and each pair has a clinical and a consumer lead. So these pairs need to present themselves in the application as having some level of working together. Now, we're not necessarily looking for, having worked together for years. It could be that you've been on a committee together. What's going to be important in thinking about the pairs is the degree to which you've had the opportunity to work through some of your issues or maybe your areas of disagreement. Because one of the things that one of the requirements of the facilitators will be able to model that collaborative practice to the participants in the program. So that's going to be something to consider. This is a major investment that the primary health networks are making and also the CHF. So when considering applying for this, and I really want to encourage people to apply, not to put them off, but we really are needing a commitment. There has to be like a return on this investment. So because we've only got the opportunity in the first instance to do one lot of training, we're really clear about the commitment we're asking of people. So we really need people that can make that commitment. So, for example, you might be interested, but if you're taking 6 months leave next year, or you're not sure what's happening, or there's some other things going on for you, then maybe you have to think about that, whether you can make that commitment. At the moment, the training program is scheduled to be held in London in March. I think it's the 15th to the 19th of March. So the availability to attend that is essential. Then there'll be the process of working with the PHN. So the training program will happen in March. In April and May, the steering group and the facilitators will actually then map out or plan how the training will be delivered. As I said, the commitment will be to deliver 2 programs over a 12-month period. Someone may ask the question, can we do 2 programs in 6 months? I haven't really thought that through enough, but I think it's probably helpful to do it over a year because you'll get experience from doing the first one before you launch into the second one. But that could be up for negotiation if somebody has difficulty doing it over a 12-month period. But would be good to highlight that in the application if that was to be the case. It's going to be also a requirement that as part of the facilitator role, for each program that's undertaken, at least a half a day supervision by Skype with Mark and Patricia from the King's Fund. And there'll also be a need to liaise with the evaluators in terms of interviews, because one of the things the evaluators will be looking at is whether the training program in London has equipped the facilitators sufficiently, because it is very different because we're having to do it in a truncated form. There's going to be a lot of pressure on the facilitators who won't have done the course in the way that the participants will be doing it. They're trying to do the course and the facilitator training at the same time. So we need to assess how effective that's going to be. The successful applicants for this first cohort will, as I said earlier, will enter into a contract with CHF. I've talked about some of these things. In terms of what we will pay the facilitators when they deliver the program, that's going to be a consultancy fee that'll be even across the board, and it won't be based on salary. So again, I might just stop and just take any questions. Oh yeah, that's a good question. Can the clinical lead also have a lived experience? Yeah, absolutely. I mean, I think it's really sometimes very hard to just demarcate the consumer sort of clinical experience, but probably need to be clear about what perspective you're coming from in the pair. Okay, so that's it for the questions at the moment. So I might just move on. The application process. It's important for people to read and understand the background information, and I really encourage you to look at the information sheets, maybe go onto the King's Fund website. That just gives you a bit more of a background of the program. It is imperative that you apply as a pair. We will be assessing the applications based on the combined knowledge, skills and experience of the pair. So for example, we're being realistic about this process too, in the sense that as a pair, one of you might have extensive skills in presentation and the other may not. They may have more limited experience. So we'll take that into consideration. Whereas, you know, as long as the skills and experience are complementary. So maybe someone's got more presentation skills, someone maybe has a better knowledge of the health system. or, you know, some of the other criteria. So we will be looking at that as a package. However, in terms of the attributes, particularly the willingness to be open to change at a personal level, the willingness to be a change agent, they're fairly critical in both the consumer and the clinical lead. They're the things that are really fundamental to meeting in terms of the selection criteria. In terms of in terms of the application itself, if you have, in terms of attachments, it's not compulsory, but if you've got, if you can demonstrate the experience you've had as a pair, you might have taught together, presented together, you may have been on a committee together, you may have over time done a lot of advocacy together, or whatever the context is. If you can just demonstrate that in a short piece and an attachment, that would be great. What we don't want to see is just a whole lot of meetings and minutes and so on, because that doesn't tell us much at all. We need to know how that working together experience has helped you understand each other's perspectives, how it's helped you rethink through your values and how you see the health system. So that's what we're really looking for in the attachments. Or if you've worked on a joint project, how that went. So again, the focus isn't on the outcomes necessarily. Sure, we're looking for the fact that you had a positive outcome in a joint project, but what's really more important for us to be looking and seeing was that through that process, maybe you started off not being able to see eye to eye, and maybe there was a lot of tension and so on, but over time, you've been able to gain respect for each other's perspective to the point you can work in a different way with each other. And that's what we're really looking for in terms of the pairs experience. So if you can demonstrate that through your application, that's what we're looking for. And it's going to be important to comply with the word limit. Just in case some of you have noticed it on the online application form, it could be a bit misleading because we've pulled together each of the selection criteria as one area and put the overriding word limit there. But each of the sections has a word limit. So when you get to that, what that means is each of those 3 or 4 selection criteria under that heading have a word limit. So it is important that you try and comply with the word limit. We're not going to be, we're not going to stop reading it after a particular period of time, but it's just so that everyone is getting the same sort of level of consideration. All the applications need to be online, so you need to submit using the online application form, and applications will close next Wednesday night at 5 p.m. Australian Eastern Standard Time. So if you're in another state applying, just be aware of the time zone difference. So just some things to think about. If you're considering being the clinical lead, just some things you might want to think about. Firstly, you need to think about what your level of clinical experience. So you need to be able to demonstrate that you've had a significant level of, clinical experience. Secondly, I'm just trying to. Sorry, bear with me a minute. I'm just trying to. There we go. I think what's really important is that you're an advocate of consumer-centred care. Because one of the things that this program's about, and probably the bigger vision for CHF, is that we really want collaborative pairs to be a tool to transform the health system in a way that it's moving towards consumer-centred care and to be working with consumers as partners. So we really, as much as the program itself, for when people are doing it, is to be able to address the mindset and practices about that. In this first cohort of facilitators, we really need those who are going to be champions of that. So as a clinical lead, we need people that are advocates of consumer-centred care and are committed to working with consumers in a new and different way and are open to change at a personal level. So they're just some things to think about if you're considering being the clinical lead. If you're thinking about being the consumer lead, again, it's similar. Need to be able to demonstrate or think about your lived experience engaging with health services. Mark, who's the architect of this program in the UK, he's had a long history of having sort of rheumatoid arthritis. He's got a number of other health conditions, and I think it was through his journey and experience of engaging with the health system at a whole range of levels that led him into significant sort of advocacy and the recognition that consumers needed to have be much more influential in terms of health service provision. So again, are you an advocate of consumer-centred care? So thinking about where you see, the health system going, the role of consumers in the health system, and are you prepared to sort of champion that the new style of consumer leader, which is a partner in shaping the health system? Are you committed to working with health professionals in a new and different way, and open to change at a personal level? Because there will be quite a bit of reflective practice. So people coming into the program need to be open to have their own mindset challenged. And as a pair, I think what you need to do to consider if you're coming together as a pair is, are you able to make the commitment, as we talked about earlier? Are you willing to lead a change process? And are you willing to be open to being changed yourself? Do you share the same vision for the future health system in Australia? One of the things that will be the responsibility of the facilitator pairs will be to model effective partnership and collaborative practice. So we are looking for pairs that have got strong communication and that have the ability to address issues and talk about the differences and the areas of disagreement, and have capacity to come to a point of resolution where they can work together and achieve a positive outcome. Now, you could be at various stages of that journey. It may be that you're new to working together, but you're already on the way to developing that, and that's fine. So this doesn't have to be something you have to demonstrate having experience over a long period of time, but I think it's just that you will feel confident that you'll be able to demonstrate that to other people that you're taking through this program. Because it's a very different kind of professional development than, and you will need to draw on your own experience as a pair, not just your own individual experience about being a clinician or a consumer. So that's probably all I wanted to say. So I'm happy to take any more questions. Okay, now, yep. They were November the 28th and 29th, but they're most likely going to be the 1st of December. But if we know your lack of availability, that shouldn't stop you from applying. We'll just need to work around it. But if you could just let us know that in your application when you're going on leave, so that if it's because one of the issues is some of the people interviewing are also going to be away. So we'll just do our best to work around it. So don't let it stop you from applying. But at the moment, that's what we're looking at. And those interviews will probably be by Skype. I think we've set the consultancy fee at $1,200 a day per person, not per pair. It will be conducted as a pair, and it will probably be done by Skype. Yeah, this is a good question. If after today, some of you still remain interested but just don't think now it's the right time for you to apply, or you can't make the commitment right now, just please register your interest, because one of the things that we're looking at, and the reason why we're having an external evaluation, is first of all we want to see whether the program is going to be fit for delivery in Australia. So that's one of the things that we'll be testing. The second thing is looking at scalability and looking at what kind of model, what would be a sustainable model if we were to roll this program out more broadly across Australia. So that could well be where we need to look at train the trainer and another training program and how we might do that. So I think it's really important that you register your interest and maybe keep updated on how we're progressing with the trial, what comes out of it, and then what happens to be further phases of this if it proves to be effective. So it sounds like that might be it in terms of questions. Somebody missed the consulting fee. It's not absolutely fixed, but I think we're looking at $1,200 per person per day. Again, if you'd like to, if as a result of today, you're still really interested, but you don't think it's going to be right for you this time, then just forward me your interest, and if you wanted to even send a brief CV. So I hope, if that's the end of the questions, that's all I've had to say. Again, if there's any further questions that you have between now and the application's closing, then if you email me, and I think Dean's going to put that out, and I'll do my best to respond by email if there's any further questions or clarification. I hope I have still encouraged you all, those of you who are interested. But I just wanted to hope to put a bit of clarity in around what the program's about, and to be upfront about what the commitment really involves, because I think it's important for you to consider what you're signing up for. Okay, thanks everyone.